The field of pediatric sports medicine has exploded over the last decade as our lifestyle has changed in North America and really the world in terms of what kids do in sports at a young age. Kids have evolved in the type of injuries they get from this incredible activity level that kids now experience. We see different injuries than we saw in the past. We see them at a younger age. We see more severity. And so our goal is to treat these in a way to keep kids active for a lifetime, but also through injury prevention and some wellness strategies and advice to families and kids on how to engage in sports at a young age to set them up for sort of a progression in a lifetime of healthy activity.
Our team is truly multidisciplinary, and we have the privilege and the good fortune to be able to work side by side with each pediatric specialist in our campus here. We have athletic trainers, nurses, psychologists, social workers, physical therapists, and pediatric radiologists who are all here working together so that we can treat athletes.
Looking at some of our athletes, we treat greater than 20 different types of athletes. But in North Texas, soccer is clearly number one. 30% of our patients are at a very high level of competition beyond their school. We see about 60% females. And most of the kids that we treat take less than a month off per year of sports. The types of conditions that we treat at the Scottish Rite Sports Medicine Center are anywhere from the basic fracture to the most complex knee injuries, including knee ligament injuries and complex cartilage problems of the knee. A majority of the conditions that we treat are unique to the growing athlete.
But the good thing is that growth and the development also allows them to heal rapidly and most of the time with rest and activity modifications, some guided therapy. Kids often don't need surgery, and that's the good news. Unfortunately, some things don't always improve and need surgery, and so our mission, our charge is to have the best research so that we can answer the questions: what needs surgery, what does not, what surgery is most effective.
The Scottish Rite Sports Medicine Center really focuses on 3 areas of research. Number 1, concussion. Not only looking at how the athletes return to play, but how do they also recover from concussion and different ways in which they can recover from concussion, like improving their sleep patterns. Another area is in injury prevention. We not only treat injuries, but we're more focused on how to prevent them from happening. And the third one is actually looking at unique injuries in the pediatric or growing athlete that we can treat the same way we can adults.
Here at Scottish Rite, our goal is to treat all aspects of the kid, anything from the head down to the toe, all the joints in between. What we want to do is keep these kids active and healthy. We want them to keep having fun, stay out there, playing sports, doing the things that they enjoy doing.
We are actively engaged in research regarding concussion management, treatment decisions, and return to play to determine what's best for young athletes to get them back to their sport safely. We take an individualized approach to treating each patient differently based on their concussion injury and symptoms. We assess their health, and then we focus on getting them back into school and ultimately back into their goal, which is to get back into sports.
Our athletes have access to our sports physical therapy team here, along with the state-of-the-art indoor and outdoor training facilities. Our sports therapy gym is actually adjacent to our movement science and performance lab, and these settings are truly the ideal places to really evaluate and train young athletes in realistic performance situations.
It helps us better understand the injuries that occur and also aids in injury prevention so that the kids can continue to play their sport without any further injury.
We have partnered with programs in the community to provide medical coverage, either as athletic trainers or team physicians. This allows us not only to take better care of the athletes in their environment, but also allows us opportunities to teach the next generation, as well as opportunities for research. As pediatric sports medicine providers, our focus is the young and growing athlete, and that's what we know and that's what we do on a daily basis.
What makes the Scottish Rite Sports Center unique is we ensure that every athlete gets the very best care with the highest level of evidence, no matter what. We treat every athlete like a VIP.
Frisco Scottish Rite is truly a special place where we have all the resources to treat an athlete under one roof, and we all have a common goal to provide the best care to our young athletes and to their family.
The Center for Excellence in Sports Medicine has a simple and singular goal. We want to see kids healthy and active now and later. We want to accomplish this by teaching injury prevention strategies, while at the same time we employ strategies to recognize these injuries on an early basis and treat them in a timely fashion to prevent these injuries from becoming lifelong problems. We do this both on the sidelines, in the clinic, as well as in the therapy gym. All of this will allow our kids to remain healthy and avoid injuries and set them up for a lifetime of healthy play.